Welcome to Dateline Health. This is Fred Lippman coming to you from Nova Southeastern University and from the Alan B. Levan Innovation Center for Broward County and NSU. And we're very pleased to have Dr. Shaye Moskowitz, who is the medical director of Neuroscience at Broward Health. And he is a neurosurgeon. And we're going to talk about Insightec brain state initiative for Alzheimer's disease and many other issues. Welcome, Doctor.
Thank you very much for the invitation.
We've been doing these broadcasts now for a little over 22 years. And really the questions come from our listeners. And, we have many hundreds of thousands of people that watch the show. We constantly get questions about Alzheimer's and the issues of, everything from oversimplistic words of, I forget things, or, to recommend, like see a neurologist. We don't give them the answers, but we have people like you, hopefully, that will give them answers. So let's talk about the initiative, and we'll go from there. Go ahead, sir.
So this is a very big subject. So I'm not sure if everybody in your audience is familiar. So if it's all right with you, I'll give you a bit of a background to the disease process, and you can tell me when I've said enough about the disease process to focus on where we're going. So Alzheimer's disease is a very specific type of dementia. In the broadest sense, dementia is a neurocognitive decline, one that perhaps is not necessarily related to age, in the sense that as we all age, to some extent, our cognitive skills, acuity, speed, processing, and memory all slow down. And that's not necessarily a bad problem, and it isn't necessarily a pathologic problem. However, dementia very specifically is compared to your age-related function, that you are falling off the curve, as it were. Now, dementia comes from a lot of different places. So under the mass umbrella of dementia has different disease processes that create this clinical package of symptoms. One of them is Alzheimer's disease. There are others too. There's vascular dementia, there's frontotemporal dementia. For other diseases can lead them to the same place. Certain Parkinson's syndromes can lead to dementias as well. So you can get there in a variety of different ways, dementia being the symptom panel of problems. So within that, Alzheimer's disease is a very specific disease process, a pathologic process in which the brain deposits abnormal proteins. They're amyloid proteins, a very specific type, and it has an interesting way of folding on itself. Don't overthink it, but this is important for conversations later when we're talking about the Insightec study. In the depositing of these proteins very slowly over time, we've learned these proteins are toxic. They cause free radical formation, they cause inflammation, and as a result, cause the brain cells to then go on to die. Through this slow, progressive decline of numbers of brain cells, in certain areas more perhaps predominantly than in others, the brain takes a hit, and its processing ability slowly starts to fall off the average aging curve. It's more profound than just simply the brain shriveling, atrophying, as it were, in that perhaps you might want to say, as we age, everybody's brain gets a little bit smaller, but it doesn't make you any less intelligent. Maybe it's more compact, perhaps, but even more profound than that, it's the number of neurons that are dying that results in processing problems. And what we see, meaning from the outside, are this panel of symptoms: memory decline, personality disorders, sleep disorders, behavioral changes, etc., that we call dementia. Okay. So that is what Alzheimer's disease kind of is in the global sense. It's a very slow and unfortunately unending and unrelenting process through which folks decline cognitively, stripping away all of the things, features, skills that we as human beings hold so dearly as defining features of people. Your ability to remember, your ability to behave, your ability to interact, your ability to speak, etc. So as these skills slowly get stripped away, dementias, Alzheimer's included, but all dementias result in an unfortunate and very, very unpleasant decline in our identities as people. That's kind of the big overarching brochure description of what Alzheimer's disease translates to. In another sense, why is it that it's so important? Well, it really is a function of how good we are, which is silly to say, but the reality is as we get better caring for cardiac disease, caring for cancers, caring for all sorts of other medical issues, keeping people alive longer, the average life expectancy goes up. So we're doing a great job moving the needle in that regard. The problem is, as we get older, the average age of the population gets older, we're finding that we have more and more diseases that are specific to the chronic degenerative process. So Alzheimer's disease wasn't relevant 100 years ago. Not that it didn't exist, it just that nobody really on the average lived long enough to get it. Well, as we do, this is becoming more of a problem. And to your point about Florida, as the average age continues to rise substantially, the percentage of the population that is over the age, well, the benchmark was 65, but 70, as you pointed out, it doesn't really matter where you draw the line. Bottom line is the average age keeps going up and up and up. And Florida particularly is a very large population of, we'll call seniors, if you like, it's a generic word. That means that our prevalence of Alzheimer's disease is going to go up and up and up, such that the disease process will become so prevalent that the cost to the system, the burden on the system, and the burden on healthcare is going to become one that is almost overwhelming if we don't find ways to better address this problem going forward. To that point, it's not just the person, it's the person and the family and the system. Everybody pays a price for this. Crazy statistic in the state of Florida alone, just the state of Florida, 1.8 billion work hours are spent annually, unpaid, to care for folks with dementia. So the economic cost is outrageous. If you have dementia and you present to a hospital, which is not uncommon, you have a 1 in 4 chance of being readmitted within the month for the same or for a recent problem. So we call it the readmission rate is very high. The disease burden is huge. The cost to the system is outrageous. Medicare pays, again, it's just a number, but it puts it in perspective. Medicare pays just over $30,000 a year per capita, not per person with dementia, per capita, every single year in caring for someone with dementia. So we spend a lot of money caring for people with cognitive decline. Locally, much more profound. So we have this very deep-seated need to figure this out and make a dent, because it's not going to get any better. It's not like the age of the population is going to get statistically younger. We're going to find it more and more in more and more people. And in doing so, we are going to find ourselves behind the 8 ball, preferably, if we can't get a better handle on the disease process. So that's the background to where we are contextually, and to your point about Florida specifically.
We hear questions from the people about what about in our pharmaceutical industry, are they producing products or are they researching on products to deal away with the plaque or the amyloids or things of that nature? So that's really the number one question that comes from our viewers.
Trying is the best answer. What exists today is what exists today is an understanding that there's a two-prong approach, I think, to taking action. The first is in pharmaceuticals, drugs of some kind, and in that arena, most of them, unfortunately, in fact, the vast majority, are dealing with symptoms. Ways to improve insomnia, which is very common in dementias, ways to improve memory. In some degree, that's Aricept and Namenda, et cetera. Medications dealing with, say, behavioral problems, which is not uncommon. So we're dealing with the symptoms. We are not changing the course of the disease. We're just simply trying to find ways to be better at the symptoms themselves, but we're not fixing the problem. And there is a line we refer to as disease-modifying therapy, which essentially is a therapy, an option, mostly pharmaceuticals, that alter the course of the disease. And last year, the FDA approved a medication called aducanumab for the treatment of Alzheimer's disease. That has its own controversy. It's kind of expensive. It's an infusion. You have to do this for your whole life. And in some sense, the data behind it is to be determined. Last month, a press release with no data yet, offering similar benefits for the purposes of dementias and Alzheimer's disease too. Data has not even been released yet, and so it's just a press release. So to be determined. The way I would kind of parse that and to help people understand what the differences really are. It's the difference between taking a medication for an infection versus taking a medication for a viral infection. A bacterial infection, a urinary tract infection, pneumonia, whatever, it's a bacteria. You take an antibiotic. The antibiotic kills the bug. Your body clears the infection. You get better. You alter the course of the disease by taking a medication. Compare that to a cold medication you take for a virus. You get a cold, your nose is runny, you kind of feel drab, you take some Tylenol or you take some medication for your runny nose. You don't alter the course of the cold. The cold is going to take exactly as long as it was supposed to course. You just make the symptoms a little bit better. Sadly, with Alzheimer's dementias and other dementias, you're not altering the course. And so the progressive decline doesn't change. You continue to get worse. You might make the symptoms a little bit better here and there, but you don't change the course of the disease. As for interventions, there really aren't any. There are no interventions, there are no surgeries that alter the course of the disease. And that's what we have. Now, as research goes, we were research directed at symptom control, better mechanisms by which you can control symptoms, and that's fair, and that'll continue as well. In terms of disease-modifying therapies, things we can do to alter the course of the disease, they're really focused on a couple of arenas. One is stabilizing the amyloid deposits, stabilizing the proteins, or finding some way where the body can react to the amyloid deposits. Or alternatively, mechanisms by which, for example, the research that we're talking about is ways to remove the amyloid, which in theory should alter the course of the disease if you believe that the amyloid is triggering the disease itself, which is pretty logical. It's based in sound research. It's been not a new concept, but the amyloid is the mechanism by which the disease progresses. So if you get rid of the offending agent, you can potentially alter the course of the disease itself. So that is the research that is around. And to that end, I might point to there are mechanisms by which folks who are interested, potentially candidates for trials, who want to know about the trials that are being held everywhere in the world and in different aspects of the disease. Shout out, for example, to the Alzheimer's Association, where some of those resources are made readily available informationally to allow folks who are interested to pursue.
I'm sorry, I didn't mean to step on your word. The other thing that comes up very often from the viewers is, are there suggestions coming from the medical community relative to nutrition and hydration? Is that something that modifies? That's just a question that we hear all the time. Is that a modifying factor in preventing the deposit of the amyloids? I don't know what the answer is, but you do.
The answer is, best we know, there are a variety of things that have been well established to alter the course of the disease, both prevention as well as stabilization. And I'm not sure whether your audience wants to hear this or not, but I'm going to say it anyway. It's obvious. Exercise, and you don't need to do a lot of it. So physical activity, mental activity, reading, puzzles, games, social interactions, meaning maintaining connections with friends, family, maintaining connections with a social circle, maintaining an active brain, all reduce the incidence, reduce the risk, reduce the course of dementias. Beyond that, eating right, controlling your risk factors, meaning blood pressure, cholesterol, diabetes, controlling your risk factors, getting good sleep. I'm not telling you anything, as you could imagine, on this list that I wouldn't tell anybody. So going and eating fast food as a matter of routine is probably not the best way to maintain your own health. Absent those obvious good things, sleep, food, diet, exercise, mental health, mental activity, and social activity, everything else is just kind of speculative. To take a nutritional supplement, there's a lot of stuff that's sold that is very true, but there is no great proof anywhere that those alter anything.
Yeah. You know, as we are living in South Florida, and actually, if you look at the entire state, but it's very dominant in South Florida, and I would say everything from Orlando, south of Orlando down to the Keys. There is a tremendous number of new ALFs, adult living facilities, and they have venues within those facilities for, I guess you could say, dementia related individuals. I know that mitigates the problems with family and loved ones, but I would assume, in observing some of their programmatic structure, that a lot of what you said about exercise, visual, I guess you could say, attempts to do puzzling, reading, things of that nature, are a dominant force in some of those venues that are attached to these ALFs. Have you observed the same thing that I did?
I would say, yeah, it should be. Engagement, exercise, activity, eating well, controlling medical comorbidities, social interaction, proper sleep, are all the keys. Now, a lot of these ALFs bundle that with safety and security. Folks with dementias have the ability to wander off, forget their medications. They have the ability to turn on a stove and forget they left it on. So safety is key as well. So a lot of the ALFs that you're referencing, that's really what they're trying to accomplish, is both engagement, quality of life, and safety simultaneously. So I would hope every ALF that has memory, attention, memory interests should do that. That said, everybody should do that everywhere, even at home, even if they're not in an ALF. Everybody should be looking to take better care of themselves, and that's part of that too.
There's the Insightec Brain State Initiative. What is the foci there relative to that?
So the focus there is to address the original premise of what we were talking about, and that Alzheimer's disease and dementias are increasing in prevalence, are increasing in incidence, and in doing so, becoming progressively more and more of a fiscal, social, healthcare related problem. Recognizing that this is growing, particularly so in certain states, Florida, one of them, the state has worked together with the company Insightec, and we're working to address that using modalities to treat the Alzheimer's disease in that regard. So what does that translate to, and how are we participating? So Broward Health, that's us, have paired with the University of Florida and Insightec for a research protocol where we try to, I guess in sum, remove the amyloid proteins and determine whether that results in a modification or an alteration in the disease process itself. So how does that work? What does the research study involve? So patients who have been referred by their physicians or neurologists with a probable diagnosis of Alzheimer's disease. They're screened for medical issues, screened for a variety of other factors, and if they are to be reasonable candidates for the study, would then be enrolled. The study itself involves treatment of the brain using MRI guidance to disrupt the blood-brain barrier. What is that? To understand what that really means is as follows. So the blood-brain barrier is a network of they call tight junctions on the blood vessels themselves. Now, typically in our body, the blood vessels have leaky holes. Think of it like a chain link fence. All the cells that line the blood vessels are attached, but they're spot welded to one another. You can easily move in and around. And that's how the body is built intentionally. Medications, drugs, chemicals, proteins all move in and out of the bloodstream for the purposes of feeding the body and then cleaning out waste product. But that's bad in the brain. A lot of things that float around in our circulation really should not be in the brain. And so in those capillaries, the blood vessels that are in the brain, instead of them, the cells being spot welded together, are actually completely welded to each other. So imagine them being stuck together by Velcro. This is a good thing because it keeps bad things out of the brain. Problem is, keeping bad things out of the brain means that once you breach the security wall and you're on the inside, there's really very little way to get it out. Hence the amyloid problem. So to address that, the equipment that we use is technology that exists already. It's using ultrasound, except dialed to be such that it does not destroy tissue. And using the MRI to localize where the plaques are deposited, we strategically treat those areas with low energy of ultrasound. And what that does is it opens up the blood-brain barrier. Think of it like tearing open the Velcro. Okay, well, why is that useful? Imagine your kitchen is filled with dogs. You open up the screen door. Now, the door will eventually close behind itself, but as long as the door is open, some of the dogs are going to get out. That's simple. So, by disrupting the blood-brain barrier in the areas where there is plaque, even if it's for a short period of several hours, that will allow the amyloid protein to leach out of the brain into the bloodstream to then be cleared away. The blood-brain barrier will then close behind it. So if we do that in several stages, we can reduce the burden of amyloid in the brain because we've allowed it to leach out and get cleared off. By doing so, we believe that should alter the course of the disease by reducing the amyloid burden in the brain itself. So that's the short version of the story.
That's rather fascinating, to tell you the truth, and it really is. Where the John Q. citizen who's listening now, where can they receive these services? At all of the Broward Health venues, or is it located in one or two of them, or so?
So the research protocol is based out of the MRI treatment center right across the street from Broward General Medical Center on Andrews Road. Now we have patients that are referred in, and they're referred in either by their primary care physician or they're referred in by the memory center, which already is geared in for every reason to be valuable for folks with dementias. We also have them referred in by neurologists, and through our research department, screen these patients for candidacy. And if they are candidates based on the criteria, which are fairly rigid, but if they're candidates, they can then be moved forward into the actual protocol itself for treatment.
That's great. I think this is very, very helpful. Like I said, the questions were almost to us sounded like people were afraid. Not of the treatment or the care, but they were afraid for themselves that they were now receiving something called dementia or Alzheimer's. I'm really pleased to know that that this service, this very technical and adroit service, is available directly through the Broward Health unit on Andrews Avenue, and also knowing that I'm sure that you're getting a lot of referrals to that center. Am I correct?
We're doing what we can to reach out. I think that this is, in my mind, it's a it's both forward looking and backward looking, and I think that's kind of important to understand. Backward looking in the sense that this is the cherry on top of the sundae. It is a very, very specific focal point to where we want to be, which is forward research and development. But the reality is that you can't forget the fact that there are so many other more important things that need to come first, that can alter the course of the disease. And to what we talked about before, people need to maintain a healthy lifestyle, be active, get good sleep, eat properly, get good nutrition, control their diabetes, blood pressure, cholesterol, control other medical comorbidities. All of those important things. You can't look to a research protocol and say, well, that's going to be it if you don't plan on taking care of anything else. So in some sense, I see that as being the cherry on top of the sundae, in that everybody should be focusing on the ice cream, which is probably as important, if not more important. If this raises awareness, I think that's fantastic. So that's the backward focusing. On the forward focusing side, this research protocol, I think, opens the door in a way. And here's how I understand or kind of focus this in my own mind. I don't know that this is the be all and end all. Maybe, may not be. Part of research is asking good questions that, of course, give you answers that prompt even more questions. But that's the point. If we can open the door to the brain, the blood-brain barrier, get something out, can we get something in? Does that mean that this is the only option? Of course not. But this is how we start, by expanding the questions and developing opportunities with what I find a very novel technology to allow access to the brain, to the body, and vice versa, that we really didn't have any good control over before. And here we go with a whole new avenue of exploration.
All right, we're down to the last 10 seconds of the show, so what I'm about to say is thank you. Thank you for not only your knowledge and your candor, but also for your advocacy. And I can only tell you, as a person that was born in the same hospital that you were born in, that I'm proud of the work that you're doing. And I hope the people out here get to know that we're doing things in your venue, and you as the medical director of neuroscience at Broward Health is trying to help them. Thank you very much, Dr. Moskowitz. We appreciate the time that you gave us today. We hope that the people that are watching know that they have to call, they have to let their doctors know what's bothering them. Don't hide anything from your doctors. Remember, folks, this is your show. This is called Dateline Health. We come to you from Nova Southeastern University. My name is Fred Lippman. Until next time, see you.